always talking down.
He's got the South Side.
Like, why you know my name, man? Like, I don't speak on you.
Hey, why you people wanna hate them? Yeah, I see the hate up in your face. I'ma keep on being real, and be myself and then I chill. Why do people wanna hate them? Yeah, I see the hate up in your face.
Oh, we live.
What's going on today? Fat Family Unscripted. We got Dr. Arthur Kennedy in the building. How you doing today, sir?
I'm doing well. How about you?
I'm doing all right, sir. I'm glad you got a chance to pull up on us, man. I know I've been busy. I've been reaching out to you, but I think I got you.
He here.
You here, the man himself.
He's here.
That's good. I'm glad to be here.
Man, thank you, sir. We're glad to have you, sir. So what you got going on? How you doing? Tell the people a little something about you.
I am a physician, family physician, and I've lived in the Columbia area for the last 10 years. I live in Emo, but I originally come from Africa.
Yes, sir.
And I've actually been in South Carolina since about the year 1998. I've lived in Orange Bed before moving to the Columbia area.
Yes.
And I trained as a physician in Africa, then in Canada, and then I've been in the US since then.
Oh, okay. What made you want to be a doctor, sir?
It was an encounter with illness. I remember when I was a high school senior, when I was deciding what to do, I got home and found out that in the one-room apartment, in quotes, that me and my mother shared with 3 of my brothers, people were crowded in the doorway, and it was because my mother had suffered a stroke. She was taken to hospital. All her left side was paralyzed. So I watched the doctors try to help her, and I said, this would be a pretty cool thing to do. And back in Ghana, you know, the joke was that at that time we had 2 medical schools, and they said that all the big boys in academics from high school and others, they headed to medicine or engineering. So I said, let me challenge myself. So I picked medicine, and luckily I got one of the 50 spots for the medical school there.
Okay, that's
good.
That's great. That's great. So tell me a little bit about Ghana, man.
Ghana, they say that it's in West Africa, obviously, right in the middle of West Africa. The Greenwich Meridian passes through it. You know that is longitude 0. It passes right through Ghana.
Yes.
So then you go east and you go west, and they say that it sits right in the armpit of Africa. The first country in sub-Saharan Africa to become independent from Britain. So it was very inspiring for a lot of Africans who were struggling for independence and for civil rights. And it has actually a very significant connection with America's own civil rights struggle.
Yes.
When Martin Luther King was jailed in the Birmingham jail and released, he was a little down, so a group of his friends said, why don't you go back down to Ghana and witness their independence, which was in 1957. So that was the first time he met Vice President Nixon.
Oh.
And there were a lot of the black who is who there. It was a very big event. And it turns out that even Nkrumah, who led Ghana to independence, had schooled in US. He had gone to school in Philadelphia. And so he drew inspiration from the work Martin Luther King was doing here. And Martin Luther King too was inspired by going to watch blacks become independent and run their own country. So it was mutually beneficial. So I have always said that a lot of black Americans underappreciate how much they have contributed to the march of civil rights across the world, because it was the inspiration from the marches on Selma, Alabama, and going to Washington and things like I Have a Dream, that helped propel a lot of us to self-awareness about ourselves. I think that aside from what black Americans did in the civil rights, maybe the other significant point in emancipation of people around the world, and particularly blacks, was the independence of Haiti, which occurred in 1801, which was barely 26 years after America's independence. So those were very significant events. But to come back to Ghana, we have a lot of tribes or ethnic groups in Ghana, from the coast up to the north. So the coastal area is a little bit of grassland, then you get to the forest area in the middle, and you get to grassland in the north. I actually come from a place that's about a 2-hour drive outside Accra, which is the capital. That place is called Cape Coast, and it might be familiar to some Americans. That was the Cape Coast. That was the slave castle. That's where the slave castle was. That's where Michelle Obama went and broke down. You go there, and there's a big building. That's the castle where they kept slaves. So in the dungeon where they keep the slaves, there is a passage, because once you enter the dungeon as a slave who was captured, you don't come out. And when they are ready to take you, they march you down a dark corridor, and all of a sudden the door opens and there's the Atlantic Ocean right at your feet. And there are the boats that will take you to the ships that will take you away from home. And she saw that and she started crying. Very emotional.
Yeah. I got a question about
Absolutely.
the different type of, I guess, the stuff that you see from Ghana compared to you see here. Like, I know y'all don't have the resources that we got over here. So how do y'all treat people with what? How do y'all treat people over there versus over here?
Oh, you mean in medicine or in general?
Yeah, medicine. Like,
okay, so let's talk about medicine before we talk about general. In medicine, there obviously are not the resources that you talk about here. So, for example, when you train there, you are trained to do more with your hands. For example, when I was in medical school, things like ultrasound were just beginning to come. So if somebody was pregnant, you had to diagnose things like breech and transverse lie and multiple pregnancies, all by feeling with your hands.
Oh.
You know, so you had to be good at it. And of course, because we were poor, you had to justify every test you order. People can't pay for everything. And just in case people listening don't know, America per capita spends more in healthcare than any other nation on earth. In the US, 20 cents out of every dollar spent in America is spent on healthcare. And yet, when you look at significant health indicators, you get beat by, or we get beat by countries like France and Germany and Britain and Canada, you know. So the American healthcare system, if you have money, you can get excellent care. Yeah. But our public health and preventive services are not as good. But to talk about, so that answers your question? Yes, you an idea?
Yeah, over here, I don't think I've ever heard a doctor say they diagnose a woman, you know, with their bare hands.
Yeah, with their bare hands, yeah.
So, and actually, when I finished my training, I did OB for quite a bit in US here before gradually pulling back. It's an exciting specialty. You are asleep at 3 a.m. and all of a sudden your phone rings and they say your patient is in the hospital, is ready to deliver, and you jumping through the snow and you wait to the hospital. You don't get there in time, you know, something will pop before you get there.
Oh yeah.
You're supposed to get there before that happens. You know. So and actually to talk about Ghana in general, you brought up resources, you know. Obviously our per capita GDP is about what? 3,000, and that of US is, you know, pretty high up there, you know. So there is a lot of disparities in income. I tell people that there certainly is poverty here and people are struggling, but there is a significant difference between what you can get here and what you get there.
Yes.
There, when you are struggling, there is no social assistance. You know, for example, I grew up in a shanty town in a big city, Kumasi, and my mother and 3 of my brothers, the 3 older ones had already left home. We lived in the same room, and it's a big compound house with rooms that are rented out to families. So the whole house actually had 2 bathrooms, and until my last or 2 years before I left there was no toilet. So if you needed to make nature's call, you had to walk about a mile. And I tell people that if you've never had diarrhea on a rainy night in Africa when the toilets are far away, you don't understand what stress is about.
Oh man,
That's tough. Nah.
And then you are afraid of ghosts, so you don't want to walk out.
No,
You know?
So what tribe you from?
I am actually a Fanti. And there are multiple tribes. Actually, Nigeria has almost 200, so Ghana has quite a few. I'm Fanti. But I grew up, now that you bring that up, my attitude is very different from my mother. For example, my mother, up to the time she was about 20, had never traveled more than 10 miles in her life. You know, you walk everywhere you go and all that kind of thing. She had probably never encountered anybody outside her own ethnic group.
Oh.
So it makes you very insular, or you look inwards. You identify with your kind. But I, for example, I was telling you I grew up in a shanty town in Ashanti region, which is a different region from where I come from, right in the middle of the country. So I grew up with people who were not from my own ethnic group. Then I went to university, high school, and then university in Accra, where you meet kids from all over the country. So people from my generation are less tribalistic.
Yeah.
You know, we kind of, I remember I tell people the story and they always laugh. My mom was a very generous woman. When my mother cooks, every child around eats because she sees everybody as a child. I'm sure you see that here quite a bit too. And I had a friend from a different ethnic group, you know, who I played with. Every time she comes to my house, my mother gives him food. So one day my mother goes, I hope you don't eat in that boy's house. I'm like, but he eats here. I've even eaten in his house already. My mother slapped me, said, how dare you do that? You know, she didn't appreciate at all the absurdity of the fact that when that boys come to my house,
Yeah.
you feed him, but when I go to his house and eat, they are bad people, so I shouldn't eat in their house. You know.
You all eating at home.
But you see, it comes from how she grew up and how she identifies with her own. People of my generation are more likely to marry people from different ethnic groups, so they are giving birth to children who come from crossing different ethnic groups, so it is lowering the ethnic loyalties.
I get exactly what you're saying.
So can you explain the importance of black health? I mean, everybody needs to be healthy, but like the importance of black health.
Black health is important because, for one thing, of course, there are diseases that are more common in certain ethnic groups than others. You know, if you look around, blacks have a tendency to be a little more bulkier than our white neighbors. It means that we tend to be more susceptible to things like high blood pressure, diabetes, cholesterol. But in addition to that, it is strange that you find out that even when blacks have insurance, they don't use it as much as whites. We always talk about, oh, blacks don't have insurance. That is true. And if you don't have insurance, it is itself a very significant problem. But we find out that even when blacks have insurance, they don't use it that much. And not only that, there is, of course, also what we call systemic racism or health disparities. As a doctor, I don't want to use the word racism. Let's talk about health disparities, which means that when you expose people of different ethnic groups to the health system, you find out that even among very ethical, well-trained doctors, somehow the treatment given to people from different ethnic groups is different. For example, we found out that when whites and blacks go to the same emergency room and complain of pain, the whites get more pain medicine than blacks.
Yeah.
You know, when whites and blacks go and say, I have chest pain, you know, the whites are taken more serious, those kind of, so those things also contribute to the problem. Having said that, if you boil it down, it means that if you are a black and you should get insurance. Even if you can't get insurance through your work, there are a lot of opportunities to get insurance, particularly in a place like US. You know, there are, of course, those who are 65 can get Medicare, those who meet the income requirements can get Medicaid, those who are struggling can come to a place like Dedicated ChenMed, which is excellent for seniors. Those who are a little younger and live a little further away can also look at community health centers. The basic thing is that you ought to be asking for help. Having said that, we tend, of course, to relate or equate health to what doctors do or what nurses do. A lot of our health care occurs away from what doctors do.
Yeah.
Exercise, you know, it matters more to one's health than what doctors will do for them. Diet, it matters more to one's health. Things like having transportation, things like
We just push the button.
being happy. You know, that recently the Surgeon General was saying that being isolated is as bad as smoking. You know, things like alcoholism, you know, all those things. Having said that, when we talk, for example, about exercise, and all those listening to me, these are things you can control. I know that life is hard, there are things you can't control, but there are things you can control.
Right.
If you do 150 minutes of exercise 5 days a week, that is walking or running or whatever you do for 30 minutes a day for 5 days. It doesn't look like much, but over the long term, it will make a lot of difference to your health. Then we come to diet. They say, you know, people are poor, they can't afford. No, there is a lot that even poor people can afford. You cut down on starch, you cut down on fat, you cut down on sodas. Water most of the time is free. Whenever you're drinking water, you're doing well. So cut down on starch, cut down on fat, you know, cut down on meat, add fruits, add vegetables, you know, add fish to whatever is it that you are eating. When they ask you, do you want it fried or grilled? Whenever you say grilled, you are doing well. Every time you say grilled, you are doing well. If you can't eat breakfast, if you can help it, eat your last meal of the day when you can see it with natural light. It means don't eat big meals late at night. Okay? And don't drink sodas. You know, these look like simple things, but if you keep doing them day in, day out, in the long run, they affect how well you are. And the other thing is build positive, constructive relationships. You know, don't go around bearing grudges. My mom, I ain't talking to her, my father, this brother, this person. Because it's shown that people who are happy are healthier, they live longer, and you can do something to help that by staying away from those things that give yourself stress. Because the stress will give you high blood pressure and diabetes and all that kind of thing.
If you stressing and you already overweight, yeah, that's going to have more problems.
Man, you just said a mouthful, man. I ain't gonna lie to you, you just said a mouthful. So I remember when I met with you, you said make sure we do it on a Tuesday. Now I can't pronounce your middle name. Could you explain to us about your middle name?
My middle name is called Kobina. Kobina is actually in my ethnic group. You get a name for the day of the week you were born. So there are names for Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday. So my middle name Kobna means a male son born on Tuesday.
Wow.
So if you are a female born on Tuesday, you'll be called Abena. You know, if you are a male born on Sunday, you'll be called Kwesi.
Quincy.
So whoever knows the day of the week in which they were born and think they come from Ghana, if they tell me, I can tell them what their name would have been. Their African name would have been.
That's hard.
So if I was born on a Friday, what my name would be?
Kofi.
Kofi?
Yes.
Black male Kofi?
Yes.
Kofi.
Kofi,
a dope name.
and my youngest son is Kofi.
Kofi? Yeah, I was born on a Friday.
I think I was born on the Wednesday or Thursday.
You will be Kweku for Wednesday. Thursday is Yao.
Oh. Kweku. I like Kweku. I like Kweku better. I'd take y'all if it was Thursday, but I'll try to take Kweku.
Kofi.
That's crazy, the significance of you wanted to be on the Tuesday. That's crazy. I didn't know that.
I knew nothing about it neither. When I heard him say it blew my mind.
Yeah. Africa is fascinating. You watch things like naming ceremonies and all those kind of things. You know, you go back to your village and they say, that guy has lived abroad too much. You know what they are talking about, because when you walk into a room in my ethnic group and people are seated, you greet from the right. So, for example, if you don't know and you think the nearest person to you is on the left and you go into there, you're like, where do you come from? You know, they are very particular about traditions and customs, you know, and respect for procedures. So you need to do that. And Africans communicate through proverbs a lot.
Proverbs from the Bible?
No, not proverbs from the Bible, African proverbs. You know, for example, you know, I go back to Ghana and people say, oh, he's lived abroad for too long. One of the very easy ways I can answer is, you know, no matter how long a log stays in water, it will never become a crocodile.
Yeah.
You know, it will take you some time to think about it, but I've explained that regardless of how long I stay away, I will never stop being who I am.
Yeah. It's gonna go with you.
Going to go with you. So we like that. So sometimes when there are complex situations, people resort to proverbs, you know, and somebody is talking about a young boy who is stubborn, they will tell you that, you know, advice never changes anybody. It's only experience and suffering that changes people. You know, that's a proverb.
So what Dr. Kennedy like to do in his spare time? What you do?
When you ain't working.
Yeah, what when you ain't working, what you do for fun or like?
Yeah, I kind of I do a little bit of, you know, yard work when I'm off, sit on my lawnmower and drive around. But for fun, I read. I read a lot.
Okay.
History, biography, you know. I've read a lot of biographies of American presidents and prominent people. I've read Martin Luther King, I've read Roosevelt, I've read Washington. Of course, I've read some African biographies as well. You know.
Okay.
Read biographies of Deng Xiaoping and Mao Zedong and Charles de Gaulle, you know. So I read a lot. Apart from that, I like chatting about sports. I follow sports a lot. Follow basketball and football and soccer. You know.
I know you love soccer.
When I go back home and I say football, they think it's association football. You know, it's American football.
Oh, yeah.
I love American football. I also follow soccer. Actually, for which one? For
American football.
American football. I actually have 2 teams. I used to have 3, but I now have 2 teams. I like Denver Broncos and the Rams.
And the Rams? Okay.
So when the season starts, I look at who is doing well, and whoever makes it into the postseason, I like them. And actually, I was in Chicago yesterday, and I met a young man who is the son of one of my friends and who plays basketball. So I'm like, So who is the greatest? Who is the GOAT? And he says LeBron. I'm like, really? LeBron? What about MJ? So he pulls his status, I pull my status, and I go, look here. MJ, 6 NBA finals, 6
MVPs.
rings. 6 NBA finals, 6 MVPs. 4 regular season MVPs. And I'm like, come on.
6 NBA finals. He ain't never lose a final.
You never lose. So I'm like, my man,
see
you
it.
know. It's like soccer. When you start talking about soccer, it's Pele. You know, it's Pele. No Maradona, no Messi,
Pele.
no Ronaldo.
Yeah.
It's Pele.
Pele.
And I always tell people that if Pele was white, nobody would be arguing about who was the greatest.
Pele was a beast.
I need to watch the movie. I did a movie on him.
He was amazing. Starting for Brazil at 17.
He was a beast.
You know, and I once told somebody that, you know, they say if you send an artist to go and get you the best soccer player in history, he will come back with Messi. If you send an engineer to go get you the best soccer player in history, he will bring you Ronaldo. But if you there's the two of them to go work together and get you the best player, they will bring you Pele.
Right. That's true.
I got to watch that movie, you know.
Pele was a monster.
Yeah.
But I'm most definitely Michael Jordan is the GOAT to me.
I ain't never seen Michael Jordan play. I just see his stats.
Yeah.
Kobe's the
Dude, it's all about the numbers. It's all about the
It is
numbers.
about numbers. I ain't never seen Jordan Grace on court. I've seen highlights.
Go watch it.
His stats speak for
Still
themselves.
on
But
anything, man.
Kobe was my goat. I saw watching grow up. Kobe was my goat.
Yeah,
I ain't never say MJ ain't the goat. Kobe is my goat.
facts and facts.
It's really, but Kobe was good. Kobe was good. Damn.
Kobe was the most. There's a lot of good people that was. Yeah, that'd be hard. That would be hard.
Do you have any family over here, or you?
I do. I have family over here. I am married with 2 children.
Okay.
My wife is a nurse at Richland, Palmetto Richland.
Okay.
She's a research nurse. I have 2 sons, 22 and 21. They both went to USC and they both started medical school last year.
I know. It's probably, that's not a family thing now. It's kind of like,
Yeah.
I mean, you can be what you want to be, but you know, you don't want to be a doctor. You don't want to be a nurse. Hey, come on.
Some in the medical field now.
Hey, come
They
on.
are good. They are good. I always joke around that very soon they will be coming home and telling me that we don't do that like that anymore.
Yeah, it's gonna get to that point.
Yeah.
So you like it over here? Been here for 10 years. You say you from Orangeburg originally? You stayed at Orangeburg?
I stayed in Orangeburg. I actually like America. There are a lot of very nice things about America. You know, I tell people that sometimes familiarity breeds contempt. You know, in Europe in the 1600s, when you are a man, of course, we didn't talk about women there. If you were a man and you turned 18 and your family was reasonably well off, they sent you to university. If they were very rich, they sent you abroad to travel for a year. And the two were considered equivalent. Traveling abroad for a year versus going to university. And they knew what they were talking about. When you travel, you see the world differently. You know, I talk to a lot of Americans who talk about all the problems here. Not that there are no problems here, there are, you know. But compared to a lot of other societies, this place has done a lot of good things. You know, that doesn't mean they don't have, America doesn't have work to do, it does. But a lot of good things have happened.
Yeah. America, I want to get some money and leave America.
And go where?
Probably Canada.
Canada. Actually, I lived in Canada before. Canada is a very nice country too, you know. But of course, I mean, if you leave America and you go to Canada, you haven't gone far. You know what they say.
You're right. You're right.
They are just your cousins, you know.
Get on
and
that
actually, people say that the thing that frustrates Canadians most is that people mistake them for Americans.
They do for real. They is like our
They
cousins.
feel like they are the nice next door neighbors, and everybody blames them for all the things you do here. But of course, talking about neighbors, there used to be a Mexican president who said, "Poor Mexico, so close to America and yet so far from God."
That's true.
John, you go back. Oh, go ahead.
No, I'm saying Mexico, yeah, that's something different over there. Yeah,
I don't want to go to Mexico.
certified.
But my point is, there are a lot of good things here. I was talking to some veterans 2 days ago, and I thanked them and I said, America is one of the few countries on earth where you get into trouble halfway around the world and they can send people to come and get you.
Oh, yeah,
They coming to get you.
I'm telling you.
Full force.
Yeah, and that is something a lot of countries cannot do. You get into trouble out there, you are on your own.
You on
They don't even know who you is. I don't even know who this is you calling me about.
Yeah.
They coming to get you though.
So it is a great country. It has a lot yet to do, but it is a great country. And
It is.
I appreciate the privilege to live here.
How often you go back home?
It varies. For example, I was there last November and a year before. So sometimes I go almost every year for some years, and sometimes I don't go for about 3 or 4 years. And people say, "Oh, so do you like America or you like Ghana?" I say, when I'm here, I miss home, which is there. When I'm there, I miss home, which is here.
Yeah.
So
That's how it's supposed to be. Yeah. I mean, like, I ain't from nowhere else, but I miss Orangeburg, but I ain't moving back.
That's how you on Newberry.
I ain't going back. I'm from Orangeburg.
you are from Orangeburg, Obed. It's a nice place. It's a nice place. Very nice.
No,
place.
it's nice, but ain't that thing.
But though, now that you bring that up, it's very fascinating when you talk to young people. I used to do a clinic at South Carolina State. You say you're from, South Carolina State. Every young person there will say, when I graduate, I'm going to Charlotte, I'm going to Atlanta, I'm going to, and I tell them that I say, all these places are pretty similar. Look, in America, they say, oh, you come from a rural area. You don't understand rural area. Look, if you live in an African village, there's no electricity, there's no pipe-borne water, the roads are dusty, and if you are lucky, there was one vehicle in that village, and it leaves the village at dawn to go wherever it's going, and it comes back at night. So if you fall sick at night, or if you fall sick during the day,
You got a long walk.
somebody will try some herbs on you or something, But here, regardless of where you live, you get to watch the same TV, you drink clean water, you have electricity. It's not that bad.
We take certain little things for granted in Mexico.
A lot.
Take a lot for granted.
But in fairness, that restless spirit among Americans has led to why America is so influential in the rest of the world, in terms of the American Revolution and the Civil War that ended slavery, the Civil Rights Act, the fact that you control the entertainment industry in the world. Most Nobel Prizes around the world are owned by Americans. All those things are indications of America's influence around the world.
That's true. That's true. Oh.
So what other platforms you are on?
I relate a lot to my university in Africa. We have platforms. Actually, until 3 years ago, I was the president of my university alumni in North America. So under that, I kind of did a lot of events. And actually, even now, I write a lot of commentary and healthcare for Ghanaians. And they published it about 2 weeks ago. I was on the largest morning show in Ghana to discuss something on politics. I remember the new year, I did a video on healthcare, giving people advice about healthcare. I think about a month ago, I did something on stroke. I discussed something on stroke for the benefit of the public.
So what's something that you see a lot of in your line of work?
Oh, you mean here or back home?
Here. Well, both, really.
Well, here, the difference is that in societies in Africa, infections are the big thing, infectious diseases. Here, diseases of affluence, as in obesity, diabetes, high blood pressure, those are more common here compared to the, so that is the difference in mindset when you are practicing.
So yeah, you've seen a lot.
So here, for example, this area that we are in has one of the highest amputation rates in the United States from diabetes. So, and that is the reason why diabetes is a very serious disease, because it affects your eyes, it affects your heart, it affects your brain, it affects the defense of your body, it affects your kidneys, it affects your extremities in terms of the amputations. So basically, I teach medical school sometimes, and as all of us professors say, if you are tired of thinking and you want to find out whether a young man knows medicine, there are about 3 or 4 diseases you ask them about. One of them is diabetes. You just say, tell me about diabetes, and sit back. So by the time he finishes, you have a very good idea whether he knows medicine or not, because it affects everything.
They do.
Okay. My question was about the diabetes. Like, I see people beating it, but how do they beat diabetes?
How do they beat diabetes? Well, basically, to go to the beginning, diabetes just means your sugar is too high, basically. Your sugar is too high. Well, it turns out that when we were discovering diabetes and insulin, they discovered insulin in connection with diabetes, but turns out insulin is a very important hormone in the body. It affects fat metabolism, it affects protein metabolism, it affects a lot of metabolism. So there are basically, if you tease it, about 3 or 4 groups of diabetics, but if you boil it down, there is type 1 and type 2. Of course, there's also pregnancy, diabetes and pregnancy, and a few other groups, but those are the 2 big groups. The type 1 diabetes people, they don't produce enough insulin. Okay, their bodies don't produce enough insulin. The type 2 diabetes, which is about over 90% of those who have diabetes, their body produces enough insulin, but their body is resistant to the insulin, and most of them are overweight. So it turns out that being overweight makes your body resistant to insulin. So you need more and more of it, and at some point, it's almost like it doesn't work. So you ask how to beat diabetes. How to beat it is simple. When your weight falls, your body becomes more responsive to insulin. So that's one. 2, you want to watch your diet. So those are the 2 big things. And the third thing, of course, is monitoring. The reason why we monitor you so much in diabetes, remember I talked about how it affects your eyes. I talked about how it affects your heart. It clogs your body with cholesterol. It leads to kidney problems. It leads to circulation problems that lead to amputation. So the reason why they like you to go see your doctor regularly is that you need to be monitored so that we can prevent these complications. So for example, once we know you are diabetic, apart from the insulin or metformin, there are medications we should give you that will protect your kidneys from the damage. There are medications that will help lower your cholesterol. There are examinations that will let us know whether there are changes happening in your eyes that we need to do something about. It can affect impotence, all those kind of things. So all those things we do that with monitoring. But if there was one thing you can do that will help diabetes to get more active, because the more you control your weight, the better. So there are a lot of people who become diabetic, they get scared and they say, no, I got to do something about it, I got to be more active. And years later, some of them can get off medication because all of a sudden they are more fit, their weight is better, and they can get off medication.
That's good. I don't want to have diabetes. I ain't gonna.
So for a person about my size, what would I, or not just me or anybody around, what would be the best thing to do?
Keep start moving. You see, the thing about exercise, you know, is that one, even if you don't lose weight, you get more fit. In actual fact, a big fit person is better off than a lean, inactive person. Being inactive itself is a risk factor.
Right.
Okay, so even if you are moving and you are not losing weight, don't think it's for nothing. Because big people who are fit and active recover faster when they get sick.
Never knew that.
Yeah. And it's not an all or none effect. Yes, we say try and do 150 minutes a week. You know, yes, that is ideal. But the person who is doing 100 minutes a week is better off than the one who is doing nothing or 50.
Right.
Yeah, that's true. You ain't doing that. You ain't about to see that. So. That's pretty much how
You
that.
got to put first some type of effort.
Yeah, I mean, even if it ain't 30 minutes, I mean, like,
It's something.
you can add, if it add up to 100 minutes, like you said.
And I tell people that, you know, people say, well, I'm going to join the gym. You don't need to do all that. Wherever you live, you know, case the area, you find out a place where you can walk for 30 minutes, get yourself some comfortable shoes. If you like music, get yourself some nice tips, you know, you put it on and you go for an easy walk, you know, slow, comfortable. When you start, you feel winded, but as time goes on, you find out that you're getting better because your body, all of a sudden, is getting more fit, you know.
Yeah. And people don't say they don't see the weight falling off, but you will. You will notice it.
You notice.
You'll feel better in your body.
I think basically these days, we all want instant gratification, so they do it for 2 weeks and they go, I'm not seeing anything. It's like diet, you know. Diets are good, but you got to stick to them. You got to stick to them.
All right. Yeah, a lot of people don't do that neither. You do it for 2 weeks and it ain't working, but you stop. I've been doing it for 2 weeks, I ain't lose no weight. Well,
And it's,
2 more weeks, keep going.
yeah, it's the same thing. You can never be a good basketball player without practicing. The people who become good, yeah, they are talented, but they get up every morning and keep going at it. The people who become doctors, they get up every morning, they keep going at it. The people who become good businessmen, they get up every morning, they keep getting at it. So whatever it is that you want to do, you got to pay the price. You got to put in the effort.
Got to put that work in.
That's what they say, pay the cost to be the boss.
Absolutely.
So what kind of music do Dr. Kennedy listen to?
All kinds. Actually, music is the universal language. I like African music, but I like jazz a lot, you know.
Jazz,
I mean, when people like Aretha Franklin, I just say wherever there is good music, I like good music. Actually, when I was training in Wisconsin, I used to like Broadway musicals, you know, when I discovered they are wonderful. And I once went to watch a Broadway musical, I think it was Showboat or something like that in Milwaukee. In a room of nearly 500 people, probably the only black there. Because, you know, I like excellence, you know, whether it is music or sports or whatever, because music, even if you don't understand the language, if it is good, you just hear it and you know this is good music. You know, this is good.
Right. You're right.
That's true.
It's going to stick out. It's going
to pull you in.
to grab it. Yeah.
I've never been a big Broadway person.
I just like all kinds of music.
I listen to all kind of music. Broadway, I can't do it. I can't sit through a Broadway show.
You can?
I can't. I can't do
So,
like. I don't do like the live music, like all
You
the
see,
singing.
I'm telling you, once you get hooked on it, because to be fair, I like some better than others. For example, I like Showboat a lot. You know, there's a black guy who sings Old Man River. It is just moving. It's just moving. I watch Hamilton. You
Yeah,
know.
see him. That's a
I
Broadway show too.
I didn't like it as much as I like Showboat. You know, I watch Miss Saigon. You know, but I like Showboat a lot. You know, maybe because it had more to do with African on the Mississippi, life on the Mississippi, and all that kind of thing. So
Yeah, probably. I just can't like live like Tyler Perry shows. Like I hate when they start singing. Like I can deal with the show, like acting it up, but when they get to singing, it's like, come on, man.
Give me the show.
no, but give us some credit. The black folks can sing.
Yeah, people sing. Yeah, we definitely sing.
I like so. You're like, yes, this is music, they are singing the national anthem and those kind of things. They do it well.
Blow
They do
now.
it well.
Yeah, we need to start taking back over. But yeah, I mean, I give them that.
We can say now. I like me personally. I get in my Motown. I'm really like a Motown head.
Yeah.
I love that old music.
And that is also one very significant contribution of black Americans to world arts and culture. All the music that blacks sang that have gone global, a lot of them.
Oh, so we talking about music, dancing. Can you lose weight dancing?
Yes, it's exercise.
I mean, like how often you gotta do it? Like,
Hey, I just said 30 minutes a day,
100 hours.
You hit them.
The doctor said 100 minutes a week.
that's the fat time.
It'll get you there. You got to be some type of active now.
Some type. You can't just nah. You
100 minutes a week.
150. He said 30 minutes a day, but 100 minutes.
It's not bad, but
Yeah,
if you can help it, 150 is what is recommended. You're hitting 150, you getting maximum benefit.
What kind of dancing though? Is it like?
Well, hey, everybody have their own strokes. They have some dancing at dedicated senior medical care where I work, and they say they do line dances. They say, "Dog, this is African dancing." I'm like, we got some broken backs after we finish.
Oh yeah, hey.
Because
Africans
there are some dances where those people they move.
Yeah, you can see it on the movies. How they be dancing.
For real, they can dance.
Them little kids that be dancing in Africa, the videos they got on YouTube.
They are good. But though, YouTube, just like Hollywood, California, it's really not representative of, the whole place. It's like people ask me about Africa, they say, oh, all these wild animals and all that. I'm like, there are actually cities in Africa that are nicer than Colombia when you go to their downtown, But in the same way, when you leave any of these cities and you travel 100 miles, it's like you drop back 100 years, because development is very uneven.
That's crazy. Drop back 100 years.
You should drop back 100 years.
Let me just say that. Said drop back 100 years.
Yeah.
That's
Because the development is uneven. You can go to all these cities with. I tell people that if you saw somebody launch a new line of clothes in New York today, in a month's time, if you go to cities like Cape Town and Johannesburg and Accra and Lagos, women will be wearing the same.
Wasn't the same thing, yeah.
And yet in the same country, if you travel 100 miles outside any of these cities, there are people walking around in rags. So there is very uneven development.
Yeah. That's crazy. I mean, but how long? Is any of our fashion over there? Where you from? If any of our fashion over here, is it over there?
Yeah. Because, because of YouTube, we live in a global village, So things that you do here, like you were talking about the kids who sing on these videos and all that kind of thing, so things become globalized very quickly,
Oh, yeah.
Some kid does some crazy stuff in Brazil, and 1 week later everybody around the world is doing it. Some kid that in Africa, and everybody is doing. So the world has become smaller in terms of influencing one another.
Oh yeah,
Yeah, that's
most
true. Yeah, I didn't think like fashion, like clothes and all that. I didn't know that. Me personally, I don't know. So I'm asking like.
That's
they
all
got-
right. We also, of course, have traditional African clothes, kind of batakari and kente cloth and things that are authentically African for African funerals and other things. But by and large, there are a lot of things that are very global. We still put on suits for official meetings, and our judges put on gowns like the colonial masters used to do, and we mock them all the time.
So a lot of people do got a lot of people don't really know too though. Africa is a nice, beautiful place too as well. There's some real nice, rich parts in Africa that look darn good.
Yeah. Actually, to give you an idea of Africa, right now we have about 1.2 billion people on the continent of Africa. And to give you an idea of transportation, if you drove from, say, Montreal to Vancouver, all across Canada, or the same as from some place in Maine to, say, Seattle, which is across the US, they say that if you didn't stop, if you could drive continuously, so there were about 4 of you and somebody is driving and the rest are asleep, you could probably get across the US in about 4 or 5 days. If you took the same journey from, say, Dakar to Mogadishu in Africa, you'll be lucky to make it in a month. Because you have all these countries, everybody has a border. You get here and they say the border guards are closed, they have to search your car, the roads are bad, the car breaks down. So the same thing that you could do here in about 4 or 5 days, it might take you a month to do it.
Wait. Oh, yeah, and you say that it's only one car from the village that leave in the day. Oh no, I couldn't do it.
I can't do it neither.
A truck that leave in the morning at dawn.
And come back at night.
You know what time dawn is? I mean,
But you see, that's my point about how you get used to things. You see, I was talking to a black lady here who said he went to school in rural South Carolina. He says, "Doc, our school buses were so old that if you look on the ground, you could see the floor. The bus floor was, kind of
Still,
and she was very emotional about it." And I said, we didn't have buses. We just walked to school, And actually, I walked about 2-3 miles to school, and it was actually pretty easy because it was in a city. You wake up in the morning and you head for the roadside. And when you get there, you see this sea of kids all heading to school. Then when school is over, it comes the other way. So you walk with everybody, and when you get to your neighborhood, you peel off. So I said, if we had had buses, would have been like, yeah. But it never crossed our minds that it could have buses for school. I was telling her to say that it's not that what you are saying doesn't matter, but perspective matters a lot in how you see life.
Yeah.
definitely.
Definitely. I'm out of questions.
I'm out of questions myself.
I'm out of questions.
We did good for us.
Hey, this is where we had to real like sit back and think clear.
Yeah.
Cause you the first doctor to come on here.
That's all right. I appreciate coming here, and whenever your audience indicates that they want me to come talk about something, I would, because I think we should all give back. We are each our brother's keeper, and I encourage all of you to go out there and be kind to other people. I tell people the story that I told on New Year's Day, that I read a story in which somebody, I think, committed suicide in San Francisco. And he said, I'm going to jump, and on my way to where I'm going to jump, if even one person says, hello, how are you doing, I won't jump. And he died, and they saw that in his diary. You know, so let us be kind to one another, check on other people, reach out to other people. It doesn't cost you that much to say good morning, how are you doing? You know, and sometimes your good morning, how are you doing might make a lot of difference to somebody's life.
Yes, sir.
That's a fact. We appreciate you coming on here, Mr. Kennedy. Dr. Kennedy.
Dr. Kennedy, you gotta put some
That's all
respect
right.
on his
That's
name,
all right. That's
man.
all right. That's all right.
Dr. Kennedy. Appreciate you, sir.
Tell them one more time where you can find them at.
Tell
Tell them
where you can find you at again.
Oh, at Dedicated Senior Care, 5900 North Main. And we actually are a new center. We take care of seniors, mostly 65 and over. A few people under might qualify. But what we do is we focus on senior care. And this is actually our first site in South Carolina, but we are in 15 states. It's our 126th center. And the care we give makes a lot of difference. Over the last 25 to 30 years, we've cut down strokes and heart attacks in our patients by about a third. We've cut down emergency room visits and hospital admissions in half. Our people are happy, as you can see when you come to our site. So I encourage all your listeners to come and bring their parents to come and see what is it that we do. I think you like what you see.
Yes, sir.
Thank you. We appreciate what you do for the community, Dr. Kennedy.
Yes, sir. Thank you for coming, man. It's Fat Family Unscripted, the doctor version.
Thank you.
All right.
Music got the sound, son. Like, why you know my name, man? Like, I don't speak on you.
Hey, why you people wanna hate though? Yeah, I see the hate up in your face. I'ma keep on being real, and be myself and then I chill.